appreciate that. A lot of times people don't have a camera or those kind of things. So it's helpful when I have some visual representation of who you are. So it's very nice to meet you. So yeah, thank you so much for the introduction. So my name is, again, is Jay Highland. I'm one of the patient care pharmacists for Jewel-Osco Pharmacy. And so I work closely on our clinical programs with a lot of the pharmacists in the Jewel-Osco pharmacies in your area. So I know that you have like the 2 Jewel-Osco pharmacies in New Lenox kind of area, as well as like Frankfurt. So there's quite a few Jewels kind of in your areas. So to kind of give you a quick overview of what I'll be talking about today is we'll first talk about kind of just medications and you. So I really want to make sure that we talk about kind of some facts around medication use in senior populations, risks associated with some of those medications, and then how to decrease those risks. Because there's always...
Hi, Doug.
How's it going? And so at any time that you, are taking a medication, there's always potential risks associated with it. So we always want to make sure that we're aware of those risks and then how we can kind of mitigate those risks as best as possible. Then we'll talk about some senior services at Jewel-Osco Pharmacy. And so we can kind of be at your service as well in any way that we can be. So just to start off, I want to talk about how medications in older adults. So in adults 75 and older, over 33% are taking more than 5 medications. So it's very, very common for an individual to be taking, 4 or 5 plus medications, being 75 and older. This can in itself increase the risk of side effects by 88%. So it's very, very common for somebody who is taking multiple medications to experience a side effect. And sometimes it's a side effect and sometimes you're not really sure, and you may think that you just have something going on, but you don't always attribute it to a medication. It's always important to kind of let your providers know, let your pharmacists know any kind of weird symptoms that you're experiencing, and sometimes we can identify whether it could be related to a medication or not. So we want to talk about what the definition of medications are, because that's very important to understanding so we're on the same page. So the first thing that might be more commonly understood is that prescriptions, so medications that you get from a pharmacy would be considered medications. What also could be considered medications is over-the-counter medications. So not just the things that you get from your local pharmacy for that one, but also the medications that you may get just from down the aisle. So your Tylenol, and something for pain, something for like a cream, something that is for allergies or stomach upset. All of those are medications and can have side effects and drug interactions. So you want to make sure that we're aware as pharmacists, as well as your prescribers are aware of those things that you're taking. Some other areas are supplements and herbal supplements, and just supplements in general. So that would be kind of your vitamins, your minerals, anything that you're taking, usually in capsules, tablets, as well as sometimes in herbal teas. It's important if there's any sort of active ingredients in those that we are aware of that as well. So it's not always just the tablets or capsules, liquids that you're taking. Medication risks to be aware of. So again, every medication has the potential of causing side effects. So you always want to make sure that we're helping to identify any side effects you might be experiencing and identifying ways to overcome those, or if they have become inappropriate because of the side effect. So some common ones are dizziness upon standing, blurred vision, confusion, dehydration, are very common side effects for most of the common medications that individuals may take. And it just depends on the person of how likely it is or how much or pronounced that side effect could be, or maybe the side effect is not there for you in those situations. But in particular, side effects like dizziness or confusion can put you at much higher risk of falls. And so you want to make sure that you take that into account. And if you start to all of a sudden feel dizzy, if you have headaches, if you have confusion, if you feel dehydrated, or if you're not drinking enough water, if you have blurred vision, any of those, you want to make sure that you let your doctor know and your pharmacist know, so we can assess whether that's associated with something related to your medications or not. Also, just taking multiple medications can mean more side effects. So going back to that slide where we had the 88% of individuals who have 5 and more medications will experience a side effect. So that's the kind of thing we're talking about when we want to make sure that it's likely that you will have a side effect for that. And it just depends on the person of what that side effect is. So just keeping all your providers in the loop on what you're experiencing so we can help to keep you safe. Another really important thing is to keep an up-to-date medication list. So this medication list should include not only the medications that you get from the pharmacy, it should also include any of the over-the-counter medications. So those would be kind of the things you get in the aisles. So your Tylenol, maybe your Tums, maybe your vitamins, your minerals. You're going to make sure to include all of those on your medication list because, again, there can be drug interactions, side effects. So the bigger picture, better picture that we have, the more that we can make proper assessments to keep you safe. So we want to know on that medication list, not only just the names, but you want to also know the strength and the dose. You want to know how to take the medication. So how are you taking it and how is it prescribed? And then time of day that you take it. This can be important because sometimes drug interactions are depend on the time of day you take them or if you take them together with something. So that's why it's important for us to know when you take them. And then any special directions for that medication. So some examples of that might be if you take a very common thyroid medication called levothyroxine, you want to make sure that you're taking that 30 minutes before you eat anything. Otherwise, it will not absorb properly. So it'll kind of bind to the food and it'll just go right through you. So you won't get the benefit from the medication. So if there's any special directions like that, make sure that that's on your medication list. So what are some smart medication use strategies to reduce your risk, which is just a fancy way of knowing or saying that how do you want to take your medications to make sure that you stay safe and decrease your risk? So one major way that you can help to prevent major side effects and problems is by using one pharmacy. So it can be very, very commonplace for individuals to use multiple pharmacies, but this actually can be very dangerous in a lot of sense where each pharmacy and each provider may not know all of the medications or all the things that you are taking. So you want to make sure that whenever you're filling a medication, that pharmacy has all the things that you take on file to be able to ensure that we can do a full check to make sure that those are safe to take together, or if we needed to alter something to keep you safe with your medications. So there's less chance, if you can use one pharmacy, there's less chance of those medication interactions because we're going to find them before you start the medication. You can build a good, strong relationship with your pharmacist. And it's important to point out that pharmacists are your medication experts. So we're available to you whenever the pharmacy is open, which is very often. We're available to you at no charge for that one. So you're going to be able to have that information at whether you have to call or whether you come in physically. We're going to be there to be able to answer those questions about medications. And just so you're aware, typically a pharmacist does 6 to 8 years of schooling and does have a doctorate of pharmacy for most pharmacists. So we have gone through at least 4 years of training just on medications. So we truly are the medication experts. So feel free to always come to us with any medication related questions. And if it's something that pertains more to something of your diagnosis or whatever it might be, then we can always reach out to your doctor to determine what the answer to the question that you might have. So always keeping, I think I already mentioned this, but always keeping your pharmacist up to date on any changes that happen. Again, just in turn to make sure that we can do a proper check on your profile to keep you safe. We can also do reviews on your over-the-counter medications. So I know that a lot of times people will go through the aisles in the cough and cold section or the pain section at, say, like a Jewel-Osco, and then you may just kind of go and buy the over-the-counter medication. But it's oftentimes very important that you come to the pharmacy to make sure and let your pharmacist know any over-the-counter medications that you're taking before you start taking them. Because sometimes there can be some pretty major drug interactions or some major side effects, depending on health conditions that you might have, that you want to make sure that there's a pharmacist or your doctor is aware of those before you start taking those from that standpoint. So just making sure. It also can be a very overwhelming section. So there's so many aisles of medications. So it can be overwhelming to know what to take for what symptoms you're experiencing or what ailment you're trying to fix. So always feel free to ask your pharmacist for recommendations and clarifications on anything that you would need. And I always know that, that pharmacist who's working behind the counter is available to you. So just because, even if you don't use our pharmacy, which we would love you to, but if you don't use our pharmacy, that doesn't mean you can't come and ask us a question at the pharmacy to help ensure that that whatever choice you are making on your over-the-counter medications is appropriate and safe. Talking to your pharmacist, so I just reiterating the point of making sure that your pharmacist knows all of the medications that you're taking. So we want to make sure that there's no interactions. You can also talk to your pharmacist about things that can help you to get the best outcomes from your medications. So that can be things like easy to open containers. We can talk about pill boxes, blister packaging, auto refills, text messaging, apps if you're tech savvy and that's something that you like to do. There's a lot of different ways that we can help to ensure to address any barriers that you might be experiencing to taking your medications as prescribed or any side effects or problems that you're experiencing. So any questions before I move on to some of the other senior services that anyone had so far? All right, perfect. Well, just feel free to interrupt if you think of any questions. So now we'll move on to some of the Jewel-Osco Pharmacy services that we currently offer that might be helpful, especially during obviously everything with COVID going on. It's important that there's certain changes that have had to happen, like today when we're making the virtual presentation, where sometimes that in-person component is gone. Whether it be at your doctor's office, whether it be at the lab that you normally go to for lab work, whatever it might be. Sometimes we can help to make a simpler option for you, or maybe a safer option if something's not currently available to you due to COVID. Some of the things that we do offer at Jewel-Osco Pharmacy is our chronic condition management services. So we can provide personalized care for specific health conditions. So some of those conditions include asthma, chronic pain, diabetes, dyslipidemia, which is your high cholesterol, hypertension, which is your high blood pressure, and migraine headaches, just to name a few. Patient care services, so any of the services that you do see at our pharmacies today have come from many years of patient care experience with Jewel-Osco Pharmacy. So we began our diabetes services in 1994, moved on to adult immunizations in 2000. Medication therapy management became very hot topic around 2005, which basically just means any service that we help to address any problems and make sure that your medications are working for you and to provide the best outcomes for yourself. Then our wellness services, which includes a lot of our chronic condition management as well as preventative care services. So one of our biggest preventative care services that we offer is immunizations. So I hope that you're all aware that you can actually come to a Jewel-Osco Pharmacy to receive vaccinations, and it can be very simple. So oftentimes all you have to do is just show up at the pharmacy when it's convenient for you, and then we can even do an assessment of what you might need for vaccinations. If you're not comfortable at this time due to COVID, that from kind of coming out into the public, always feel free, you can just call us. And we can always set up an appointment where it could be a kind of a no wait option where we can have everything ready to go and you would come in the store just to receive that vaccine. And it might even be possible to do a drive up option as well. Just give us a call at the pharmacy to see when those availabilities would be for that. So some of the common immunizations that we offer is obviously our annual flu shot, which is extremely important, especially today with everything going on with COVID. So your flu shots, your pneumonia shots, these are extremely important for you to be protected from on a normal basis. But with COVID, there has been a lot of situations where healthcare systems have been overrun. So basically there's not enough resources to help treat everyone. So we truly want to make sure that any flu cases, any pneumonia cases that we can prevent going into this next fall flu season is we really want to make sure that that's at the forefront of our efforts and that we're doing everything we can to help prevent those situations, because it's very common for flu and pneumonia to cause hospitalization. And with resources being more scarce, that can turn into a very extra serious situation, more than normal. Some of the other vaccines include the tetanus with the whooping cough portion, hepatitis A and B, meningococcal vaccination, shingles, and HPV vaccinations, just to name some. I wanted to kind of go over quickly just kind of what is pneumonia. So pneumonia is an infection of the lungs that most commonly is caused by bacteria. So there's various routes of infection for pneumonia or pneumococcal infections, and it's very similar to COVID. So all the things that you're doing, hopefully to help to prevent COVID, are great tools to help you to prevent pneumonia as well. But with pneumonia, one thing that is different than COVID currently is that you would be able to use those vaccines that are available to help prevent against those particular strains. Whereas, COVID, we don't currently have a vaccination that will help to prevent against that, hopefully coming soon, but not at this time. So for risk factors of pneumonia is age. So anybody who is 65 and older, you are already at an increased risk just with the age. For that one, cigarette smoking, alcohol or narcotic abuse, underlying health conditions. Some of those conditions can include diabetes, lung conditions such as chronic pulmonary disease or asthma. Also taking certain medications. So some examples would be the proton pump inhibitors. So if you are taking Prilosec or omeprazole or Protonix or pantoprazole, or any of those, anything that usually ends in a ZOL or ZOLE, oftentimes those can increase your risk of pneumonia as well. This just shows you some two big pictures of lungs. So this would be kind of your healthy lung. This would be an example of a lung that, so that obviously looks painful to think about breathing with that area of the lung being overtaken likely with fluid. So there's two pneumonia vaccinations that are currently available. So you have Prevnar 13, which protects against 13 types of pneumococcal infections, the ones that most commonly cause hospitalization or very, very serious illness. And with that vaccination, it was shown to provide 45.6% disease reduction for individuals who are 65 and older, which is great to help decrease that risk. Then there's Pneumovax 23, which protects against 23 different types of pneumococcal disease, and that's a 57% disease reduction. So with the pneumonia timing of the administration, so there's a group of individuals who receive the Pneumovax 23 under 65. So those are those higher risk individuals with chronic health conditions, such as diabetes, cardiovascular disease, lung conditions, and current smokers. And then everyone, it's recommended for them to receive the pneumococcal series above or 65 and above. And so typically you would receive the Prevnar 13 when you turn 65, and then a year later you would receive the Pneumovax 23. So I wanted to quickly talk about the shingles vaccine because that's kind of one of the newer vaccines. So I get a lot of questions around what to know about the vaccine, what is shingles. So if you have never seen somebody who's had shingles, some people are unaware of what it is. So shingles is known as herpes zoster. It's caused by varicella, which is the virus that causes chickenpox. So what can happen, or what does happen, is that individuals will get chickenpox as a child. Oftentimes, it happens as a child, and then it's going to come out as shingles later in life for that one. So it's not that you're getting infected with shingles. So say you are 70 years old and you have shingles. That doesn't mean that you got shingles from someone else. You actually got chickenpox from someone else when you were younger, and now it stays in your spinal cord, and basically it can come out at any time as shingles. So that's kind of how that works. It's not necessarily an infection that you transmit. You don't give somebody else shingles from your shingles. This is an example of a shingles rash across the face. So it can affect anywhere on the body, and it can be very serious. It can affect the eyes. Like in this situation, it can affect internal organs even. It can cause a very large rash, and it can cause a lot of nerve pain, which can actually be permanent or very long-term kind of nerve pain. They call it neuralgia. So what are the risk factors of individuals for shingles? So people are at risk. They include individuals who are 50 and older with a weakened immune system. So if you have a weakened immune system, that automatically puts you at risk for shingles. If you're affected by cancer and if you're taking certain medications. So generally the medications are going to be ones that decrease your immune system. So if you've ever been told that you're immunocompromised, that's usually going to be the situation where you're going to be put at risk for shingles. So Shingrix is the name of the new shingles vaccine. So it's been shown to be very effective for any vaccine. It's probably one of the most effective vaccines that has come out recently. It reduces the risk of developing that herpes zoster virus or rash by 97.2% in patients who are 50 and older, and even individuals who are 70 and older, it's still at 88.8% chance that you will not receive that. So it's a reduction, which is very, very good for a vaccine. So it makes it very minimal that you will actually have shingles after receiving the shingles series. So who's recommended to receive this vaccine? So it's healthy adults age 50 and older, adults who were previously vaccinated with Zostavax. So if you've ever heard of Zostavax, it was the old shingles vaccine that was just a one-time vaccine. It was a live vaccine, so a lot of people had some strong reactions on the back part of their arm. But even if you received that vaccine, that one did give you some protection, but this one actually gives you even more. So the CDC does still recommend you to receive the shingles series, the new shingles series, Shingrix, even if you did receive previously the Zostavax vaccination. So the administration is a 2-dose series, and then you administer the first dose, and then you administer the second dose 2 to 6 months later. And if you were to happen to go past that 6 months, so we've had instances where individuals didn't feel comfortable coming out, especially when COVID was, when the stay-at-home order was stronger, that those individuals may have gone past that 6-month time frame. And so if that's the case, that's okay. You just want to receive that shingles vaccine, that second dose, as soon as possible to help you get that protection. You don't have to start the series over, especially if you had a copay, and that would be a lot of money. So if you can't make it to the Jewel-Osco Pharmacy, which might be definitely possible right now, don't worry. Our pharmacists can actually come to you to provide vaccinations, just as we're talking about for the drive-up options, being able to come into a store to do a no-wait vaccination or any services that you would need. Just give us a call and we can kind of talk through the situation that you're in and how we can kind of help to support you, especially right now. Have your insurance card ready, and we can do our best to help you save money as well. So the more information that we have and the more kind of discussion that we can have around your medications, we can help to hopefully save you money as well. So I know there's not a lot of whole traveling likely going on right now, but just so you're aware, we do have a travel health program. So whenever you may be traveling later, then we can always help you to identify both oral medications as well as vaccinations that might be needed for that travel. We provide a variety of health screenings. If there was something that you needed done blood work wise, we're usually doing more of like a finger stick blood sample for most of our health screenings. So some of them are on the spot, so you would know the results right away, such as like an A1C, blood glucose, blood pressure, and the lipid panel. Some of the other ones are mail-out tests, but usually we have those results within 48 hours of mailing them out. Medication therapy management. So if you ever have any questions related to your management of your medications, we can help to optimize your best medications, make sure that the evidence that's out there of what helps to keep you safe or healthy longer, we want to make sure to match that with what you're taking. We can decrease the reactions you may have from medications, and then also obviously help with cost savings if cost is a barrier for your medication. You can always ask for a complete medication review, so we can go over all your medications with you to talk about the appropriateness of them, cost savings opportunities, address any adherence issues. So if you're having trouble taking the medications as the doctor had prescribed them, then we can always work to help you to identify ways to help you stay on track for those. And we can also do training and education to provide on all of the medications that you're taking. We can do blood glucose monitor trainings. So let us know if you ever have a blood sugar machine that you have any questions on. We can go over that with you. And some of the additional pharmacy service that we have is free automatic refills on medications. We can do prescription delivery. We can do text messaging reminders, and they're easy with an app, again, if you're technology tech savvy. Various insurance plans are accepted, various discount programs we have available. We can do blister packing. If you have any pets, we can fill your pet medications. And then, you know, we work to have many locations as well as convenient hours and knowledgeable, friendly staff. Here are the references for that. And were there any questions that anyone had? I hope I didn't go too fast.
I have a question.
Yes.
Somewhere between slide 16 or 17, you mentioned medicines that end in SOL mean, or ZOL mean what?
Yep, correct. So that would mean that could potentially put you at higher risk of pneumonia for that one. So there's been some studies that have been shown that the proton pump inhibitors, so that would be those like Prilosec, you know, which is omeprazole, or your Protonix, pantoprazole. There's a few others like Nexium, esomeprazole, that those can actually put you at a slightly higher risk of pneumonia. So it doesn't mean that you should like stop those medications. You know, you could again talk to the pharmacist, talk to your doctor about whether it's appropriate for that medication to be taken, because sometimes people take that almost accidentally for a long period of time, where they maybe had an issue where they had a little bit of acid reflux, and then they just started taking it forever and ever, but it doesn't necessarily mean that you needed to be on it forever and ever. So anytime that you have those situations, we can help to identify those and help you with recommendations around that. Does that make sense? Perfect. Thank you for the question. Any other questions that anyone had? Let's see, I think that the screen that's labeled Ronald, I don't know if she's trying to talk. I apologize.
Okay, let's see. Oh, there. Yeah, it's Kathleen. I'm sorry, I'm under Ronald's
Kathleen.
email.
Oh, no problem at all.
Does that mean that these proton pump inhibitors decrease your immunity? Is that why it makes you more susceptible to pneumonia? Does it decrease other immunities too?
It actually generally, it can increase the risk of certain infections. So it's not necessarily, I wouldn't necessarily call it that it's going to make you immunocompromised, but it's going, the way that, because how a proton pump inhibitor works is it's inhibiting the proton pumps in our stomach. So if you have the acid reflux, if you have the kind of that burning sensation that happens after you eat, what's happening is it's helping to decrease the acid that our stomach produces. So that can change the way that the rest of our body works, because those proton pump inhibitor or proton pumps are around our body. They're not just in our stomach. So it can just change that. So it can change some of the you know, stomach and then like your colon and areas like that. It can affect that. So that's actually where that pneumonia increase is likely, is that there's sometimes our body has to produce acid to change the pH in our lungs. And so that's where those are altering the, you know, the lung function for that one. So that can slightly increase that. It's not a drastic increase. It would just be, you know, if you needed to be on that medication, then it would just be extra important, kind of an extra risk factor to make sure that you can get protected as best as you can.
Okay, thank you.
Yeah, absolutely.
Wonderful. Do we have any other questions?
That's it.
Okay, great. Jay, thank you so much for taking the time to speak with us today and giving us this great presentation. We truly appreciate it. Again, is there any other questions for our speaker today?
No, thank you.
Wonderful. All right. Jay, thank you so much again for your time. Let's see here. Oh, I thought you froze for a second there. Anyone else from the committee? Marissa, anything you'd like to add for today? I think I have to unmute you. All right, sounds good. Well, thank you everyone so much for attending our virtual triad meeting. If you have any questions for myself or Marissa or any of our law enforcement partners, please feel free to reach
I
out to us.
apologize. I think mine had frozen a little bit. Did I miss
Oh,
any
that's-
questions?
No, I don't think so. We appreciate your time, Jay. Thank you so much again. If anyone else has any questions for any of us, just please feel free to give us a call, shoot us an email. We will go ahead and send out this recording. And if you have any questions for Jay in the future, we can go ahead and leave maybe a contact phone number for him as well, or an email.
Thank you.
Great. Thank you so much, everyone. Have a great afternoon.
You too.
Right.
Thank you so much for having me. I very much appreciate it and hope y'all